On the forecast? No, you let Mike take care of that?
Yeah.
We're talking about actually some good news for the Buffalo area, a new initiative that's going to be launched here.
Sure.
We just won something, which we like to hear. Can you tell us a little bit about what's going on?
Well, we actually three actual health homes that are developed, and health homes are pretty interesting. I'll put the first slide up.
Okay.
It talks about, you know, transformative initiatives for the Medicare redesign, and it's new technology to coordinate care among more complex patients. Also, local communities coming together to set and build on their strengths and increase coordination between sectors, and it's a way of integrating delivery system, and that's how we're going to basically have Medicaid sustainability. How our model was different is we're patient-centered medical home, but we're going to be focusing on mental illness, substance abuse, and a lot of the housing and social issues. So I mean, you're coordinating the care along all those arrays. A lot of times we were just in the office and doing that. And the last slide is it's all part of the Affordable Care Act. So like I said, the trains left the station, and it's going to be an interesting model that's working pretty well with our communities.
Now, how does this tie in with what's going on with the Sheehan Health Network? Because they've been talking about closing that, and you've been talking about maybe a way to save it. Does this tie in with that? You
know, that's a very good question. It definitely does. And they were actually one of our partners when we applied for the health lead. And I think that's why all these services will really bring a lot of value to the community. So yeah, and we're talking with them at this point. So I think that's how, and this is a 3-year pilot. So there's a lot of sustainability that comes as a result, and a lot of different services that can be provided for the community.
Primarily, Doctor, who does this benefit? Low-income patients or overall the entire community?
Right. For now, it's Medicaid, you know, that's going, but a lot of the Medicare pilots are going to follow in light of the large Medicare recipients that are going to be developing into the system, and then finally the insurance company. So I think it's a way to integrate a lot of the care that we haven't really looked at, so that we know exactly how patients are utilizing services, how to better equip ourselves to provide better services to them.
Now, is this a kind of a long process to get to this point where you won this and you can go forward on it?
Well, yeah, we had an application process. There was I believe about 40 applicants initially. Then it came down to 18, and then we had 6, and finally 3 were selected by the Department of Health.
Okay, Dr. Raul Vasquez, we appreciate your time as always, and we'll see you next Tuesday with another medical topic. You can have, if I can get more information on this topic today on WKBW.com.
We'll be right back.
Thank you.